Can teeth with restorations, like crowns and fillings, can those get new cavities? Now, this is a really good question that my patients ask me all the time. A crown or a filling is usually done to fix a tooth with a cavity. So, can the problem reoccur? The answer, unfortunately, is a resounding yes. New cavities can form around fillings and crowns. In fact, teeth that have been previously repaired, they're actually more likely to get a cavity. So, why does this happen? Is it because there's a problem with the restoration? If the restoration isn't fully sealed the tooth, it does increase the risk of a new cavity. Over time, fillings can begin to wear down, chip and crack, allowing bacteria and debris to enter the tooth and begin to form a new cavity. Similarly, tooth-colored fillings are bonded, which is what causes them to adhere to the tooth surface. With time, that bond can begin to weaken, breaking the seal and allowing bacteria in. Crowns, on the other hand, are sealed to the tooth with cement. Again, with time, that cement layer can start to break down, increasing the risk of getting a new cavity. Now, sometimes teeth with fully functional crowns and fillings can still get a new cavity. Now, this is frustrating, but why does it happen? Think about it this way. The original cavity formed before a restoration was ever done, and there is still tooth surface exposed under the margin, which is the area where the filling or crown is sealed to the tooth. So the restoration is doing its job, covering a portion of the tooth and protecting it. However, the surrounding tooth surface can still get a new cavity. Does that make sense? So now that we understand why cavities form around dental restorations, let's shift gears. Let's talk about how to prevent that from happening. You've made an investment in your teeth. How can you best protect that investment? Good oral hygiene is a great place to start. Make sure to brush at least twice a day and floss every single day. Oftentimes, these new cavities will form between the teeth under old crowns and fillings. The toothbrush just doesn't do a good job cleaning between the teeth. That's why flossing is so important. Fluoride products can also help increase the lifespan of fillings and crowns. Look for toothpaste and mouthwash that have fluoride in the ingredient list. Oftentimes, these products will say cavity protection or anti-cavity right on the label. The specific brand doesn't really matter, as long as you're getting the fluoride included. After you brush or rinse with mouthwash, just spit it out. Try not to rinse with water for at least 30 minutes. This will allow the fluoride to sit on the teeth as long as possible and just really do its job. Now, for those patients who have a lot of fillings and crowns, it's that much more important to keep up with your regular dental visits and x-rays. It's recommended that you see the dentist at least every 6 months and get x-rays taken at least once a year. In addition to getting your professional dental cleaning, this will help detect problems with restorations while they're still small. Oftentimes, a filling with a small defect can be replaced with another filling. However, if that cavity is given time to grow under the filling before it's detected, it may require a crown, and sometimes even a root canal. I'm Dr. Andrew Vallow. In my new office, the Dental Boutique West Chase is planned to open this February. I invite all of you watching to join our VIP list, where you'll benefit from priority scheduling as well as discounted and complimentary dental services. We will also have a special surprise for our first 100 patients. You can learn more about our practice, submit an insurance check request, and join our VIP list at our website at www.westchasedentalboutique.com. So whether you think you might have a new cavity or you're simply interested in tooth whitening, we look forward to serving you.